Welcome everybody. We're Classic Surgeons of Lexington. We are in our hair restoration suite, and we are covering another Wellness Wednesday topic. Today's topic is going to be hair restoration, and I'm sorry I've got a water bottle because I have I'm getting over the flu, which my staff really appreciates. We do hair restoration in this room here, and hair restoration is a sort of multi-modality treatment. It's anything from shampoos to platelet-rich plasma to our hair transplant machine. We invested in a product called NeoGraft, and I'll get into that in just a second. We treat men and women for hair restoration. They actually have two different mechanisms on how they lose their hair. Men, we know specifically it's related to a breakdown product of testosterone in the level of the scalp, and we can treat that by adding platelet-rich plasma to the area, which has a lot of growth factors to stimulate hair growth. And then if someone's far enough along with their hair loss, we can do hair transplantation. In men, it's not male pattern hair loss. We actually call it androgenic alopecia. Alopecia is standing for baldness, because it is related to androgens like testosterone, like I just mentioned. The hair in the back of a male's head is genetically programmed never to go away. So even if someone is completely bald on top of their head, you can take the follicles from the back of the head and move them to the front. And that's how hair transplant works. For probably the last 20 years or so, we've been using individual follicles as opposed to large grafts of hair with multiple follicles in them. The individual follicles can either be harvested by a strip method, where you actually cut out a strip of the scalp and cut up the scalp into individual hair follicles, or you can do what we do, which is NeoGraft, where we actually take a handheld device which attaches to this machine here, and it goes around the individual hair follicle and plucks it out by suction. And that way you know you're going right around the entirety of the hair follicle, and you're not going to transect through the base of the follicle, for instance, which you might do during a strip method when you're cutting up the scalp. So NeoGraft quotes a 98% take rate, and that's why. It's because you're not damaging the hair follicle during the harvesting process. Another advantage is you don't have the big scar in the back of the head, so you have these individual puncture holes that heal over the course of a week, and as your hair grows out, you can't notice that it's missing. You can take about 15% of the hair in the back of the scalp and on the sides before anyone would notice that any hair is missing. That hair gets transplanted to the top of the head. We do it all here. It's, usually people are going to get as much hair as we can in one session, which is typically about 2,300 to 2,500 grafts. We do it in this chair here. It takes all day to do. You're on your belly at first, harvesting hair, and then you switch around. And then we have a TV, which you can't see on the screen right now. You can watch your favorite Netflix series, and we start placing the grafts in the area where we want to have them placed. The recovery time itself takes about 1 to 2 weeks. Some of it depends on how willing you are to let people know you've had it done. And then it takes about a year to see the final result. And the reason why is because of the hair that's transplanted, the follicle will actually shed the hair shaft, and it takes about a year for that hair shaft to grow back to where you can see a difference. And so it's something that you have to be very patient with. Alternatively, we do offer platelet-rich plasma. Platelet-rich plasma is very good for younger people who are thinning, or we use it a lot with women. The way that it works is platelets have what we call alpha granules inside them, and those alpha granules have a lot of growth factors and cytokines. And so when you inject it in the scalp, those alpha granules release all those growth factors and cytokines, and it causes these little tiny villus hairs to grow, and so you can get thicker hair that way. And it's a great way to sort of treat a younger patient, for instance, who has some thinning but is not necessarily bald.
You want to show it?
Sure. We have a picture of it. The bottom picture is the before picture where you can see scalp, and the top picture is the after picture. And it takes 3 sessions to do, and then you're going to need follow-up treatments on a yearly basis.
Let's show the
And then we'll show the hair restoration picture here. So the before pictures are with the hair shorter, and the after pictures are with the hair longer. We filled in the frontal scalp as well as the temporal recession, and he's also had PRP treatment. So overall, he just has a thicker head of hair with a lower hairline, and that's a year out. In addition, so people who get the hair restoration, the NeoGraft, they receive our shampoo products. Those shampoo products help prevent the breakdown of testosterone to dihydrotestosterone, which is what causes male pattern hair loss at the scalp level. This is our PRP system. It's an Eclipse system. We call it liquid gold. It has the gold color to it, and we do it once a month for 3 or 4 sessions, depending on the results and what people are looking for. And then again, it's something, male pattern hair loss or androgenic alopecia is something that is a lifelong battle. It's not something you can treat one time. If you treat with PRP, for instance, you're going to need some maintenance treatments over time. But even if you have hair restoration, like the gentleman that we showed just a second ago, the hair that's on top of his head that was there prior to the hair transplant is at risk for being shed over time. So he would be wise to continue with PRP treatments as well. Lastly, we have a hair light system. We bought the hair light system basically to help keep hair shafts after a hair transplantation in place, or more of them in place, and hopefully that they wouldn't be shed. We also use it, we've used it on a number of women, for instance, who are in sort of crises in their life. They're under a lot of stress, and they sit under this light and they feel like their hair stops shedding. And we do think that it does help in that respect. So I think I've covered everything we have to offer with hair restoration. We can take questions
somebody
at any time.
asked if it's painful for either NeoGraft or PRP.
It's so I don't think anything that you do is not going to be without pain. I think it's a very tolerable pain. Basically, you have to be able to sustain needle sticks in the back and the front of the head to numb up the scalp, and then while that's being done, you also have some medicine on board to help you feel less anxious and less pain. So we give you a pain medicine and an anti-anxiety medicine. And truth be told, most people generally fall asleep during the harvesting process, and then they'll doze off here or there during the transplantation process. So it's a very tolerable pain. And as far as discomfort afterwards, there's not a whole lot of discomfort.
Dr. Lynch wants to know, how does he get hair like yours?
It's a very good question. It actually is a good question because expectations are one of the hardest things in our business, and we show a lot of pictures and we try to describe what people are going to look like when they're done with whatever procedure we're doing, and hair restoration is no different. So just as an example, someone is never going to have a completely bald top of their scalp and have hair like mine. It would be very difficult to get to that point. Most people don't have enough hair to get to that point, but managing it, that's a good question. Managing expectations for anything we do is important, and so based on how someone looks, we would try to manage what their expectations are.
So if you're a woman in your 50s and 60s and you've noticed your hair thinning, what would you recommend in that situation?
Excuse me, there's a couple things. One is Rogaine can be used for men and women. You can pick that up. I think you can even pick it up over the counter. It's minoxidil. We don't know how it works, but that's something that you can try. It is a bit cumbersome, I've been told. You have to paint it into your hair twice a day. It's a bit oily. I think an easier thing to do is to come to our office and get injected with PRP. It literally takes about a half an hour to an hour in our office. There's no downtime with it. It's again, you have to come here once a month, maybe for about 4 months, 3 or 4 months. But it is scientifically proven to increase density in the hair. PRP. Let me back up a step. PRP is used everywhere. I mean, they were using it on bowel anastomoses. They were using it in knees. To my knowledge, there's no literature to support that. The only literature that has shown any evidence of utility is in hair, and it has been shown to increase follicular counts when you're looking with a densometer. So to me, it's a very easy thing to do. Pam, our nurse, does it. She draws the blood off herself, and then she injects it with small needles in the scalp. It's, again, it's not without some discomfort, but it's relatively pain-free, and there's no downtime to it.
Do we offer some type of shampoo or product to help with hair growth?
Yeah, so we have these hair products here, and again, they're designed to help prevent testosterone being broken down to dihydrotestosterone. And that, again, that's the mechanism that causes androgenic alopecia in men. We do not know the mechanism of action for why women get female pattern hair loss. And because we don't know the mechanism, sometimes it's a little more difficult to treat. What we found works best with women is PRP. We've had a lot more success, and you saw the picture there in the woman that we injected PRP into her scalp. You can see her scalp before, and then after the PRP treatments, you can't see her scalp anymore.
And how many treatments was this?
3. And she's going to do a 4th. But again, it's something that you sort of have to do maintenance treatments on. You can't just do it 1 3-month session and then you're good for the rest of your life. If you have a tendency towards thinning, it's something that you'll have to keep up with.
One viewer asked, would Dr. Hill disclose whether or not he has had the procedure done?
I have not had the procedure done. We thought about showing my partner's hair before he had his hair transplant and then mine after, but we decided against it. All right, so I think we'll end things for today, and please follow us on Instagram, please follow us on Facebook, and thank you for your attention.